Hello, my name is Dr. Nicholas Cohen, and I'm here to share with you a top 10 list of tips for women with bacterial vaginosis. Tip number 1. Know when to suspect that you have bacterial vaginosis. Bacterial vaginosis, also called BV, is the most common cause of vaginal discharge in women of childbearing age. It causes a fishy odor and it can be most noticeable after sexual intercourse. However, many women with bacterial vaginosis have no symptoms at all. Bacterial vaginosis is important because it increases your risk of getting HIV, gonorrhea, chlamydia, and herpes. Tip number 2, see your doctor. If you are having increased vaginal discharge or a fishy odor after intercourse, it's important to see your doctor to make sure of the diagnosis of bacterial vaginosis and to make sure you don't have another type of infection. Tip number 3, don't smoke. Smoking is one of the proven risk factors for bacterial vaginosis. So there are many reasons not to smoke, and reducing your risk of bacterial vaginosis is another reason. Tip number 4, avoid douching. Douching, or applying a liquid into the vagina, is actually a risk factor for bacterial vaginosis. Many women will douche just to make themselves feel fresh or clean, but actually douching can disrupt the bacteria that are normal in your vagina, particularly lactobacilli, which produce hydrogen peroxide and which actually protect your vagina from bad bacteria. So it's important not to disrupt the good bacteria by not putting douche into your vagina. Tip number 5 is limit the number of sexual partners you have. Multiple sexual partners is a risk factor for bacterial vaginosis as well as sexually transmitted diseases. So it's important to only have one sexual partner at a time. Tip number 6 is to treat bacterial vaginosis. So your doctor will prescribe you treatment for bacterial vaginosis, and there are generally 2 types of treatments. One is by mouth and one is a gel that's inserted into the vagina. A recommended treatment is metronidazole, 500 milligrams, twice a day for 7 days by mouth. An alternative treatment, which is just as effective, is a metronidazole vaginal gel, which is inserted into the vagina once daily for 5 days. Whenever taking metronidazole, it's important not to drink alcohol because you can have a serious reaction which will involve chest pain, dizziness, and low blood pressure, and can be dangerous. Another tip about taking metronidazole or any antibiotic is to make sure you complete the entire course of your antibiotic that's prescribed. Even if your symptoms go away, it's important to finish the treatment course of your antibiotic so that you don't cause the bacteria that you're treating to become resistant. Tip number 7. Sexual partners of women with bacterial vaginosis generally do not need to be screened or treated for bacterial vaginosis. The exception is women who have sex with women. Women who have sex with women, their partners should be screened for bacterial vaginosis and treated if they have it. Tip number 8. If you have recurrent bacterial vaginosis, which is more than 3 episodes of BV in a year, it's recommended that you be treated with prophylaxis or a protective dose of metronidazole for 6 months. You can discuss this with your doctor, but in general, you take 7 days of metronidazole by mouth twice a day, 500 milligrams, along with boric acid vaginal insert, 600 milligrams, for a total of 21 days. That starts on the same day as you start the metronidazole. And then after you complete the vaginal boric acid, your doctor will test to make sure that the bacterial vaginosis has cleared, and then prescribe a vaginal gel of metronidazole twice weekly for 6 months. This can help women who have repeated episodes of bacterial vaginosis. Tip number 9, treatment in pregnancy and nursing women. Women who are pregnant and who are having symptoms of bacterial vaginosis should be treated, and in general the recommendation is metronidazole, the oral form, 500 milligrams twice daily for 7 days. Women who have symptoms, women who are nursing with bacteria and have symptoms of bacterial vaginosis, in other words, women who are breastfeeding and have symptoms of bacterial vaginosis, should also be treated, but they should be treated with metronidazole vaginal gel for 5 days. And tip number 10 is to believe in yourself. Bacterial vaginosis is very common, it's not a sexually transmitted disease, and there are effective ways to prevent and treat it. I hope these tips have been helpful, and thank you very much for listening. Have a great day.